Welcome to Drivewell, staying safe behind the wheel. By the end of this presentation by the National Highway Traffic Safety Administration, you will know more about the many steps you can take to keep driving safely as you grow older. Let's talk about some common myths and facts about older drivers. True or false? You cannot tell if a person is a safe driver based on his or her age alone. True. Older adults have fewer total crashes than other age groups. When you compare the number of crashes adults ages 20 to 45 years old have to the number of crashes adults over age 65 have, you will see that the younger age groups have more crashes. However, if you are in a car crash after the age of 65, you have a higher risk of injury or death than a younger driver, and your risk increases as you get older. So an 85-year-old person has a higher risk than a 65-year-old person. As you get older, you may become more frail, which makes it harder for you to heal. Let's talk about another common myth. Older adults need to stop driving when they reach age 75. Age does not make a driver safe or unsafe. Regardless of your age, you can continue to drive safely as long as you are physically and mentally fit. No matter what your age, you can drive safely if you are still physically fit. This means you can still maneuver your body enough to maneuver the car and to fully scan for traffic around you. If your cognitive abilities, that is your mental abilities, are still good, your mind is sharp enough to make the quick decisions required in driving. If your car is well maintained, your vehicle will be safe to operate. If your car is fit to your body, it will be easier for you to maneuver it. If you make smart choices about when and where you drive, you may reduce your risk of a crash. Let's consider how your physical fitness affects your driving. Better physical conditioning will help you stay safer while driving. A Yale University study of people 72 years old and older showed that adults who walked less than 1 block a day were more likely to be in a traffic accident than people who exercised more. Physical fitness is important to safe driving because it impacts how well you can maneuver the car. A person who is fit enough to drive can still move his or her shoulders and arms enough to fully move the steering wheel. A person who is fit enough to drive can turn his or her neck and shoulders to fully scan the traffic. And a person who is still fit enough to drive can quickly react and move his or her feet between the brake and gas pedals when needed. Do you believe you will automatically become less physically fit as you age? True or false? There is nothing you can do to protect your body from the decline of age. False. Talk to your healthcare provider about exercise that is appropriate for your health. You can keep yourself fit if you walk or get other exercise most days of the week. You also may be able to try some light weight training a few days a week to keep your muscles strong. Some health conditions common among older adults can affect physical fitness, eyesight, and clear thinking. These conditions include diabetes, Parkinson's disease, cataracts, macular degeneration, glaucoma, Alzheimer's disease and other dementia, and the aftermath of a stroke. Any of these conditions can make driving more difficult. It is important to get regular checkups with your healthcare provider to diagnose and manage any health condition that you may have. Do not forget your regular checkups with your eye care provider, too. Good eyesight is critical for safe driving. And get a hearing test as part of your regular checkups to remain a safe driver. Good hearing helps your awareness of the traffic around you. You need to hear the approach of emergency vehicles or the whistle of a train. You also need to hear when someone is honking the horn at you or other traffic. Make sure you follow your doctor's orders, including any prevention and treatment advice. If you do have a diagnosed health condition, make sure you follow all of your healthcare provider's instructions and ask how the condition can affect your driving safety. Prescription drugs you take for your health conditions can sometimes cause side effects that are dangerous for driving. Watch this brief video to see how blurry vision, drowsiness, and confusion make driving unsafe. Make sure you talk with your healthcare provider about any side effects your medications may cause, and whether a new prescription may interact with any drugs you are already taking. Many side effects can interfere with safe driving abilities. A drowsy driver can start to fall asleep at the wheel and cause a crash. If you find yourself feeling drowsy behind the wheel, find a safe place to pull over and take a break. Talk with your healthcare provider about drowsiness or any other side effects you may have from your medications. We've talked about how physical fitness can affect your driving. How about your mind, your brain fitness? If you have a sharp mind, you can more quickly figure out what is happening on the road around you and react faster to changes in road or traffic conditions. Do you think you will automatically lose focus as you age? True or false? You may get more forgetful as you age. True. Some memory loss may occur as you age, but you can continue to drive safely. You can work to keep your mind sharp. Challenge yourself with games and puzzles. Try new activities that are interesting or exciting to you, and stay physically fit. A healthy heart also helps keep your brain healthy and sharp. Your body and mind need to stay fit, but so does your vehicle. A car in good repair is less likely to break down while you are driving. Get regular engine checks and repairs from a mechanic. Keep your windshields clean to reduce glare and increase your visibility. Keep your tires fully inflated to reduce the chance of a flat tire or a blowout. Your car also needs to fit your body. You can make many adjustments to your vehicle so you are more comfortable and have more control operating it. If your car is adjusted to your needs, you will be able to more easily maneuver and control the vehicle, which will make you a safer driver. These are some things you can do to adjust your car to fit your body. Check yourself. Are you seated high enough to clearly see at least 3 inches above the steering wheel? You need a clear line of sight out of your front windshield that is not blocked by the top of your steering wheel. If you are not seated high enough, try raising the driver's seat and lowering the steering wheel column. Check yourself. Is there space between the bottom of the steering wheel and your thighs? You need to be able to fully turn the steering wheel without bumping into the tops of your thighs. If you cannot, try adjusting your steering wheel column up. Check yourself. Are you seated at least 10 inches away from the steering wheel? In a crash, the airbag comes out of the steering wheel very quickly and forcefully. This force can hurt you if you are sitting too close to it. If you are seated too close, move your seat back. However, make sure you can still easily reach the pedals. Check yourself. Are your side mirrors adjusted to reduce blind spots? In the past, it was recommended that you adjust the outside left and right mirrors to see a part of your car in the mirror. Newer recommendations suggest that you adjust the viewing angle of the side mirrors so far outward that you can no longer see the flank of your own car. In this position, you can see traffic approaching from the rear sides of your car. Check yourself. Can you easily move your foot from the gas pedal to the brake pedal or the clutch? Can you do this without lifting your legs or body off the seat? You need to make solid contact with each pedal to be in control of the car. If you cannot do this, try moving your seat forward, up, or down. If you need help adjusting your car to your body, identify community groups that sponsor events to check how well your car is adjusted to your needs. You can also consider an evaluation from a driving rehabilitation specialist, especially if you have any medical conditions that are changing your physical abilities. This specially trained occupational therapist will determine if you need any adaptive equipment to help you operate your car, and will provide the practice you need to drive safely. A professional evaluation with a driving rehabilitation specialist, or DRS, can help a person decide whether or not driving is still a safe option. The goal of the driving rehabilitation specialist is to keep drivers safely behind the wheel whenever possible. When you first meet with the DRS, she will conduct driving assessments to observe your reaction speeds, judgment, planning, and maneuvering of a vehicle. Once the testing is finished, the DRS can make a plan that may include adaptive devices for your vehicle. The DRS will choose equipment that is compatible with your vehicle, and over the course of several sessions, train you how to use it. A driving rehabilitation specialist will also help you develop strategies to help you cope with vision or cognitive impairments. A qualified mobility equipment dealer should install any equipment the DRS recommends. Some states require that your driver's license note any adaptive devices on your vehicle. Not every health problem can be overcome with vehicle adaptations. Eventually, you may reach a point where it is no longer safe to drive. A DRS can help you make that decision. Recognizing signs of change as you grow older. As you age and your body changes, you may need to change some of your driving habits to continue driving safely. Is it harder for you to see at night? You should consider limiting or quitting driving when visibility is more challenging. For example, at nighttime and during sunup and sundown when the glare from the sun and headlights is stronger. You should also limit or quit driving during bad weather, such as heavy rain, snow, and fog. Is it harder to navigate roads when they are busiest? you should consider limiting or quitting driving during rush hours or driving on highways. Very crowded, fast-paced roads demand even more quick thinking and actions from the driver. Take less crowded roads at times of the day that will not require prolonged, intense focus. Increase the distance between your car and the cars in front of you. This will give you more time to react to a sudden change in traffic. Consider enrolling in a driver refresher course. Driver safety courses are a good way to refresh your skills and learn the latest rules of the road. And in many states, insurance companies offer a discount to drivers who finish a driver safety class. Look online or contact AAA and AARP about the courses they offer. You may also be able to find an in-person driver safety course in your area. Driving is an important skill for independent living. You can be safe behind the wheel as you age by staying physically and mentally fit, and by adjusting your driving habits as needed. Thank you.